How do Medicare copays and coinsurance work? Have you ever wondered how Medicare copayments and coinsurance actually work? Understanding these terms can help you manage your health care costs better. Let's break it down in simple terms. First, a copayment, often called a copay, is a fixed amount you pay for a specific service. For example, you might pay $20 for a doctor's visit or a prescription drug. This fee is usually paid at the time you receive the service. It gives you a clear idea of what to expect for certain visits or medications. Now, coinsurance is a bit different. It is a percentage of the cost of a covered service that you pay after you have met your deductible. For instance, with Original Medicare, you typically pay 20% coinsurance for most services. This means Medicare pays 80%, and you are responsible for the remaining 20%. If a service costs $1,000, you would pay $200. Speaking of deductibles, this is the amount you pay out of pocket before Medicare starts to share costs. Once you meet your deductible, coinsurance kicks in. In Original Medicare, which includes Part A for hospital insurance and Part B for medical insurance, you will first pay a deductible. For example, Part A has a deductible for each hospital stay. After you have met your deductible, you will pay coinsurance, which is usually 20% of the Medicare-approved amount for most Part B services. It's important to note that some Medicare Advantage plans may have copays instead of coinsurance. In these plans, you pay a fixed fee for certain services. One thing to keep in mind is that Original Medicare does not have an annual out-of-pocket limit. This means that your costs can add up over time unless you have additional coverage, like a Medicare supplement plan or a Medicare Advantage plan that includes limits on out-of-pocket spending. Knowing your copayment and coinsurance amounts can help you plan for your health care expenses. Copayments provide predictable costs since you pay them at the time of service. On the other hand, coinsurance can vary depending on the total charges for the service you receive. Supplemental plans can help cover these out-of-pocket costs, making it easier to manage your overall expenses. So, to sum it up, Medicare copayments are fixed fees paid per service, while coinsurance is a share of the service cost you pay after meeting your deductible. Both methods are ways Medicare shares costs with you, helping you manage your out-of-pocket expenses effectively.